Stephanie, I seen your hand very bright. I think you put your hand right by your light. Go ahead, Stephanie. I see you put your hands up to answer.
Yeah, well, I mean, I know what my normal is. So if something abnormal happens, I would go to my doctors, or I would be the first to detect it. Because every woman should know what a normal is like. Okay? So if you have an abnormal swelling or a gland or something, you should know that's a red flag. So it's good to know what your body looks like. It's good to know during your cycle what your discharge look like, because it changes with the cycle. And as you age, your body also changes. Okay? So what was your normal for when you were 15 would not be your normal for when you're 50. So you have to keep it real. So at 50, some people have gray hair, you know, and it's normal. So you don't go dyeing it because it's normal. Do you understand?
I wonder who not laughing. I give you the wrong number. That's a good one, Stephanie. That's a good one, Stephanie.
Yeah, keep it real.
Luan, that's a good one. You hear me? Avenel? Avenel, clap, Avenel, clap.
They're not dying it.
Don't dye it because it could be dangerous to your health.
Well, it's important you shave it. You know, you shave it.
Yeah, or you shave it. But I know of people who dye it and end up with anaphylaxis. Everywhere was swollen because they dyed it. Because they want to keep up appearances and make themselves look young. So they put dye on it, cheap dye.
Okay,
Stephanie.
But who is seeing on there?
Okay, Stephanie. Mary want to say something right now.
Mama Coco, you're off the screen.
If it's also important that if you have a partner, a husband, let them know what it looks like. So in case something is going on, you can ask them, have a look. I'm feeling something here, what it looks like.
Yes.
What you think it looks like. Take a photo. Take a photo of it and show me. Let me have a look.
Yeah, that's true.
Yes.
Every woman should have
I do it. I do it. I let my husband have a look. If something feels funny, have a look. Take a photo. Let me have a look. Because otherwise I can't see them. I can't see. So I want to know.
That is important when you're pregnant, because sometimes you can't even see.
So Stephanie, you are saying a woman should have a mirror, a portable hand mirror in the bathroom or in her room.
Yes.
Yeah, you could have a mirror if you live alone like I do. I don't have, my husband is dead. I don't have anybody to look. I don't want people coming peeping just for peeping sake. Because after they look, they might want to taste. So I use a mirror.
Ladies and gentlemen, take your children out of the room right now. Stephanie's on board.
Yeah. And then in the pregnant woman, when she has a very large belly, her habitus has changed. It's challenging for her to see. So it's good for her husband to be able to know what the normal is, so he could pick up the abnormal.
I received a shaving once, and the shaving didn't end. The shaving didn't end, and everybody get up and go to Scarborough. No. Or everybody get up and go shopping. The shaving creates an encounter. Yes, it created just what they see when they shave and they pull and they see how it looked. Invitation was there. I'm hearing that no one is seeing me, but they're hearing me. Yes. I didn't get shave alone. So I understand what you're talking about.
But Mama Coco, a lot of women goes to these salons to get wax. You go to your GP male, they examine you. Why can't you let your husband or boyfriend examine you?
I know.
Why are you embarrassed of your body?
Let them shave you and all, and they will get some. And they will get some, and they will get some immediately.
But I think as well, just to interject, beside we observing ourselves and ensuring that we're normal, but there's also the need to have your checks with your nurse, or your nurse, for your regular pap smears and things like that. I think this
Very
is so
important.
very much important to have around this, when you need to have it, because we have cases of cervical cancer and things like that, and some people, because they didn't check, it led to other things. And I mean, we had quite a famous case here in the UK where I think the person didn't, I think she used to did have the abnormal sort of smears, but didn't follow it through. But only when she went on to what they had a Big Brother program here in the UK she was on, and then she went to India, and then for some reason she got checked, and when they checked it, that when they checked her and everything else, she was found to be too far gone anyway. But I think it's important when you check, you can see abnormal discharges and other things, any kind of smells and stuff like that, so that you can stop something from advancing. And I think that's my take on it.
Research has also shown that about 80% of breast cancers are found by husbands and partners. Exactly. By massaging the wife or partner's breast, they find lumps. Research has shown that. So examining your body, letting your partner know what's normal for them and for you, when they feel it, what feels normal, what you feel, what feels normal, is very important for health promotion.
Mary, can you center yourself and raise your device? Mary. Yes, raise your, yeah, go up some more. You're too up. I think I don't know what management will say, but you are right down too low. Let's raise your iPad. Yes. Nice. Well, Mary, that's a deep one. That's a deep one with the breasts and the massages and stuff like that. But we have some men, some men doesn't even treat you with a good breast massage. They don't do it. They just whap, dap, ship, dap, droop, doop. So that is not only a good way, it is a great way that we could get some men doesn't believe in foreplay. Some men don't know what foreplay means.
No. Yeah. And it's all about culture.
Yeah.
It's
about culture. And we have to remember that most African Caribbean women first encounter was a forced one.
A rape, yes, a forced one.
It was like a forced encounter. If you talk to most African Caribbean women, they would say the boyfriend held them down because they were either young, they didn't know what to do.
They didn't say yes.
It's not part of our culture. Like
they didn't say yes.
In Ghana, they prepare you for sex, and it's part of the on becoming a woman. They teach you how to treat a man, but we don't have that here. So a boy like Captain Caveman, he hold you down and he forces himself on you. So that in itself is traumatic. So most women are apprehensive about it because they keep remembering their first encounter, which is a bit traumatic.
And holding down came from the plantation, yeah?
Yes.
Hold on and take it. Wherever, once you're a woman and you pass by, whether you're smelly or you're Nelly, whether you're kneeling or you're standing or you're going against a tree, they take it. So what else can we speak of here? We have Avenel could answer on this question.
Sure. I mean, and just kind of piggybacking off of what Stephanie said, when you have those first initial encounters and, for most women, losing your virginity should be something that is special. And there are several people where, they've lost their virginity and it's already very painful. And you have these encounters and, you have this rabbit jumping you from behind or wherever he's jumping you from, and he's rough. He doesn't take his time. He doesn't know how to do the right things, and it's just like a sad mentality. I know from experience how when my virginity was taken, it wasn't a very pleasant experience. And it just, it does play back over in your mind.
Yes, it does.
As time goes by, it can definitely affect your mental way of thinking towards sex, because you get into that place where, you might have sex with somebody, but because in your mind, it's already locked off, that you don't get those pleasure signals. You don't get wet. You suffer from vaginal dryness. And, it makes it then even worse, and as someone, like I make sure that I get my yearlies. I check myself. I examine myself. I don't wait for no one to examine me. I make sure I do that on a daily. If I go to in the shower, I'm checking, to make sure there's nothing different. I mean, ever since I was a kid, I was always interested about certain things, and I knew where certain things was, if there's a mole there, and I check little things to see if anything pops up new. I mean, if you to yourself, you have a mole on your breast and something just popped up there, that could be an indication that something could be going on. Or another thing too, that when we shave, a lot of us women and probably men, we get that ingrowing hair, and we don't shave the right way, in the right direction, because the hair flows in certain directions that you have to follow. And if you don't do it the right way, it's people who suffer from recurrent ingrowing hair, where it's like that, they get these little boils that come up ever so often. And it may not necessarily be a good thing. It's all about technique. You have to know how to do it the right way. For one, you don't want razor bumps, using the wrong type of razors.
Dirty razors.
You don't want to reuse razors exactly. I mean, they have the disposable one. You don't want to reuse razors. And then, to be honest, sometimes we have to piggyback off of the stuff that men have available to them, because we could get our little shaving cream and, make it a lot easier, so it's not as abrasive on the natural skin. You just have to know how to do it the right way. Exactly. And so, like I said, I go and I get my yearly pap smear. I remember I did have, I think the year that I had my son, after I had my son, I had an abnormal pap that came up. And I had to do a colposcopy, which basically what that is, they take a biopsy of, or a swab of, that area, just to test it, to make sure there's nothing wrong. And a lot of the time, we have things within our genetics that we aren't really precursed to. And what I found out is that I can never get on any hormonal birth control ever. And sometimes when you take those birth controls, as great as it might be for all, or it has side effects, because you might take this birth control and it gives you that vaginal dryness. You might take certain medications that give you vaginal dryness. You might be precursed to having recurrent kidney infections or recurrent urinary tract infections. And all of these play a part, and so, and not only that, even with testing, you have to also think back. Are we making sure we're wiping the right way when we go to the bathroom? We get these, we give these urine samples, and we have accuracy in collection is key. If you don't wipe and you don't make sure you let that first couple drips drip out first before you put that cup there, you contaminate your sample. So that and all, gives you a precursor for having issues, because it's going to come up that something is wrong with you when it really is not really a situation. So it's all about procedures and how you do certain things. And, self-educating. We have to self-educate. We are our own advocates. You have to advocate for yourself. You can't wait for someone else to advocate for you. Get your breast exams. check yourself, know where things are, know how they feel. You'll know if it feels different, and that way you know if you need to go to a doctor and get yourself checked out. And don't be stigmatized by, all right, the doctor down the street is a male, I can't go to him because I don't feel comfortable, opening up myself for him. Better safe than sorry. Exactly. Because if you have to wait and you wait and you wait and you wait, it's only going to get worse. Time's of the essence. Time, like one of my uncles had a word he used to say, is time waits on no man, is man that waits on time.
Yes, man have to wait on time.
Man have to wait on time. So when you sit down and you're waiting to think all these old school recipes are going to help, not always. Not always.
Wow, wonderful. What a wonderful section of this question that was answered by Avi. So Joanne and Luan, can you guys answer this question also? Who's going first? Joanne?
Can I say something? Can I say something before we move on?
Yes, Joan. You have to leave.
Someone just put up a question about a statement about the dryness. Sometimes when you're going through menopause with the vaginal dryness.
Yes.
Keep some coconut oil by your bedside.
Natural.
So
works well.
So a person could use. Yes, keep some oil there, something there.
Yeah, after you shower.
Well, that's a fact.
After you shower, you just oil there. Just put back moisture by using oil. Don't use soap in that area.
You see who can answer? You see who can answer first? Let's lead off with a new topic. Because
and the other thing
I understand that coconut oil is one of the best lubricants.
Yes.
And she makes coconut oil.
Natural.
And the next thing is, a lot of West Indian women like to put their hands up and wash.
Yes.
So that in itself dries out the mucosa. It dries it out. So it should not be practiced. The only thing you should put it, they wash themselves by putting their hands up.
Putting their hands up with
and
even putting up germs there, no?
Exactly.
Just like you moisturize the other parts of your body, your vagina has skin that needs moisturizing. So when you shower and you dry your skin, you put some coconut oil there and keep the moisture.
Yes.
Wow.
That's why when at menopause age it dries out, you keep reapply moisture.
Moist, yeah.
Well,
don't use Dettol.
Oh my God.
Savlon.
And Savlon. That's a Savlon.
And soap. Don't use soap. Don't put soap there.
Don't put nothing there but soap and just water.
Yes,
soap,
Joan needs some of your coconut oil.
Okay, yeah, definitely.
No, we are going to post it, we're going to post your coconut oil right now, so people can get. No, this is not a joke, Joan.
No, that's serious.
This is why you're on the live today. You're here to promote. You're here to promote that oil so that your daughter, because you make the oil so that you will get donations for your daughter, the daughter who died from cervical cancer. And your oil, Joan, I will show them your oil soon that I have in my house. I just received my supply a few weeks ago. But before we do that, we're gonna give Joanne and Luan a chance to answer this question.
And probably Avi at some stage as well because she's Delaford too. So yeah,
yes, Avi too.
Delaford in terms of healthcare and development is
Mary,
right? What do we have in Delaford? We do have a health center, and I think
is it the best?
The 21st
is it the best?
Can you hear me?
Is it the best?
No.
Is it the best?
What do you mean? If the health
center is the best.
Oh, okay. You know, I haven't been to it for all these years I've been away. But 26 years ago, it would have just been a simple health center where you went down to do your dressings, check your blood pressure, and stuff like that. So I don't know how much development it has seen. But I think where we are in the 21st century, we would want to see a state-of-the-art health center, because, you know, so many people are dying from chronic diseases, and sometimes people, you are here and then you hear somebody die, you know, likely that person may not, they're just living, they may not have been having themselves checked. So I think if you want to have a health center where the nurses and the healthcare support staff could do things like ECGs and be able to interpret the results, right? And then you need to have a doctor on site as well who can also readily help to assess these results and tell somebody, well, look, you've got hypertension and this is impacting on your heart, or you may have an enlarged heart, which can then lead on to a cardiovascular accident or something. So you want to have, I think in Delaford, that's what I think I would like to see, a well-run health center with all the facilities, which means that they can diagnose easily and help to treat and help to decrease the loss of life. That if we really do research, I think we may be having, people are dying prematurely at quite young ages, and there may be reasons behind that. They're not checking themselves properly, and then again, the facility may not be there to do all of that. So I think in the future, definitely improve healthcare, proper state-of-the-art health center, and all the equipments and facilities which will help them to get the necessary treatments that they may have and diagnoses. That is what I'm seeing for the future, really. And I think, I will leave Luan to go on to her specialty in terms of where we're looking at childbearing and that sort of thing. So,
well, I think before I go on to that, I would like to say Delaford, like many other villages, is an aging population. And I think we have to meet the healthcare needs of the people. So it's not about building big facilities and infrastructure. If you consider that half the population in Delaford might not be able to access these healthcare facilities, so we should be taking these facilities to them. You know, I remember growing up, I don't know if anybody remember Nurse Edwards.
Yes, Nurse Edwards, yes. Everybody from there.
So
yes.
That Nurse Edwards was a big lady and she was going everywhere. So if you couldn't come to the health center, she would be going to meet you. And I think, you know, that people living on hillsides, people are double amputees, people have got, you know, strokes, are not able to go to the health center. So therefore, we should be changing the healthcare facility. So we should be mobilizing our district nurses. So maybe we don't have district nurses, we have health visitors. And, you know, recently I've seen a lot of health heroes, you know, going up on, you know, on Facebook. And I'm really, really, really happy, you know, for our health heroes in Tobago. But we have to be more innovative. You know, we have to take our little bag and take off those posh uniforms and, you know, start climbing those hills. Because the people can't, most of them can't come to us. You know, I had an experience when I went to the Delaford Health Center, and, you know, I went with my dad, and the first thing he said to me, please don't come in and make any noise with the doctor. And I said, well, I'm just only coming in to listen. And as I was standing there, he had a blood pressure of 89 on about 49. And the nurse did the blood pressure, and there was no communication whatsoever. So I turned and I said to the doctor, do you not find that there's a problem with the blood pressure? Oh, well, his blood pressure is always like that. The pulse rate is always that. And I said to him, I said, well, what does the pulse rate indicate? So it's being able to tell the patient, when you undertake an investigation, you are able to tell the patient, look, these are the results, right? This is what, these are the actions that we are going to take. Say to the relatives, look, it's not important. Why should my father or any other ageable person be going to the health center? Oh, it's blood pressure day on Thursday. So what happens if you feel unwell before that? You know, there's nobody else to investigate. So I think, you know, with the changing needs of the population, we ourselves need to be more innovative. We need to be meeting the needs of the population and identifying ways in which we can be supporting, you know, those individuals that are not able to access our healthcare facilities. So I think that Delaford, apart from all, I said, I don't really believe in putting up lots of infrastructures. You know, there's lots of health centers going up around Tobago. What are we providing? Are we meeting the needs of the people? Of course, no, we are not, because we have got a hospital that is not fit for purpose. And, you know, until you, you know, that hospital comes in line with some of the hospitals that are in Trinidad, why are we building health centers? Because it's just another building. We are not meeting the needs of the people at all.
Oh, yes.
Can I say something?
Can I? Sorry. I think we still need to, if we're going to have the health centers on the ground and have them like we have it in Delaford, we still need to have, it should be well equipped still, regardless of, I agree with the point of taking the healthcare, getting the health visitors to go in and see them in their homes because they can't get to the health center. But then you're still going to meet a group of people who still need to come, who can mobilize and get there. And so we still need to have the necessary equipments and necessary training. As I said, the example was knowing how to interpret an ECG and also knowing how to understand when you do a patient's blood pressure, know how to read it immediately. The nurses, you don't need the doctor to do that. This is where a nurse will see that the blood pressure is abnormal. She highlights it to the doctor, or she should know what to do, right? And even a health support worker, if they're because they've been trained for 2 years, they should be able to see that it's abnormal and also know what to do. And if they don't exactly know what to do, then you highlight it immediately to the doctor so that he can take action. They should know what to do and they should be able to treat them on site, right? So that, I mean, if you have to take somebody with quite a low blood pressure like that and they are becoming, their condition deteriorating, you don't want to be forcing them into ambulance and running. You want to be able to do
stabilize them
immediately before you then take them in. So I still believe that we do need to still have a well-equipped health center, which is still state of the art if you don't need to do something expansive. And I agree that being innovative and taking the care to the people who can't get to the health center, because you can go out with mobile things like ECGs or blood pressure and stuff like that.
Stephanie, have something to say, Jojo?
Yeah.
Having worked in the public health service as a district health visitor, the system
Tobago,
Delaford is a sessional health center. So the main health center in that area, there are 4 main health centers basically, and they have more extensive services and the nurses are there all the time. So Roxborough is the closest one, right? So strategically placed, Roxborough, Delaford is between Roxborough and Charlottesville. So they only have sessional clinics. So most of the times the health center is run by nursing assistants and they do dressings and they will do the blood pressures and stuff like that. But I feel they need to be more, give more patient-focused care and do more home visits, because a lot of the patients, as she was saying, as Luan says, they are shut-ins and they need to maintain the shut-in registers so that you would know your high-risk patients. That is a mandatory requisite as a health visitor. You need to know your shut-ins in your area so that you will be able to identify your needs. You do a needs assessment. You know who your shut-ins are, so you know who you need to visit, who would need. Some people, they can't come out because they're double amputees and stuff like that. And then the nurse would only come up like once every 2 weeks or whatever for clinic. So if anything happens in between, there is no redress, you know? So that needs to be addressed from the, you know, more patient-focused care. And doctors used to do home visits too. So sometimes the patient can't come out and the terrain might be difficult. So you need to be able to deliver that care.
Mary have something to say,
change
Stephanie.
The system. It's too rigid.
Well said, Stephanie, but let's give Mary this chance. Ladies and gentlemen, we are just past the 90 minutes and our show will soon come to a closure, but we can't close without hearing certain things, and we have closing statements coming up, so you guys will still have a chance to speak. But Mary have something to say on this specific topic.
Yes, Tobago need what is known as walk-in centers.
Yes.
And strategically placed throughout the island.
True.
And it does not need a doctor to manage this, because I am a nurse practitioner. I don't need a doctor. I see patients.
Come in the center, Mary. Center yourself. We want to see you.
I see patients. I assess patients.
Look up to the microphone.
I prescribe for patients on my own without needing a doctor. I am able to read ECGs. I am able to do all this. So if you have nurses that are nurse practitioners and advanced nurse practitioner at that, where they can see, assess, treat, evaluate, discharge patients, strategically set out throughout Tobago, half of the problems that you have will be eliminated. It will take off a lot of weight from the accident and emergency department as well. Patients would not have the need to go there. They will know they can go to a walk-in center and get treated. Roxborough has one at the minute. Canaan has one at the minute. So they need some more that is run and managed by nurses that are well trained. Because Tobago don't have nurse prescribers. No. I don't think they
don't have practitioners either.
No, they don't have it. It's not widespread.
Yeah, they don't have that one that is working.
Mary, we're not seeing you at all. You turn your face away from the people. Center yourself, because you have some deep, valid points that I want the Secretary of Health to hear. And come more to the right of you.
They do not have practitioners.
That's better.
Yes.
Yeah, I remember hearing a program, a young woman who came from America as a nurse practitioner, and she struggled to get accepted as a prescriber in Trinidad. I have one of my best friends is in Tobago at the minute, is a nurse practitioner and nurse prescriber, and you can't get work in Tobago to do that. You can set up walk-in centers throughout Tobago that can help the people. And your district nurses also need to be more proactive and more on the ball. You can't have a district nurse going out to see a patient once in a while. We need patient register where all diabetics are on a register, where all asthmatics are on a register. All women who are within the smear need to have smears within that age bracket on a register that can be accessed, where you can send out letters to them, ask them to come in to have their smears done, remind them of their diabetic reviews, remind them of their asthma reviews. These are registers that is able, because every person in Trinidad and Tobago of voting age is on a register. So that in itself can be used in order to weed out all the diabetics on a register, and that will stop people dropping through a loophole and being missed, and treatment is not being followed up. So these are the things that the healthcare system, especially in Tobago, need. We need a proper register of patients with chronic diseases that can be seen and treated and followed up.
Amen.
Well, ladies and gentlemen, I think we are here at the end, where I would have liked to hear Avenel's response to that question. But Avenel, you will use your time for your closing statement, which is right now, to speak on what you believe and what you can confer and confirm about Delaford's healthcare because of what you heard from the past three guests.
Okay, so I think they make really good points. You do need to have infrastructure in place. When considering any demographic, you have to know, you have to basically go around and research them. You have to know how many, you have to bracket them into age group. You have to know, we have our elderly, and these are the age, these are the diagnoses that they have. And then you have to make sure you have enough manpower to serve that community, that particular community, the amount of people that live there, the population. If you don't have enough manpower to take care of your population, it will never work. Having someone come from Charlottesville to come down to Roxborough for care is absolutely ridiculous. Having someone, and you have to also remember there's restrictions, there's barriers that stops them and prevents them from getting there outside of even their own health. Transportation is not always the easiest.
No.
People don't want to go to Delaford or Charlottesville or Speyside. You know, nobody wants to have to then be sick in the middle of the night sometimes and have to be worried, oh my God, how I get in there. You know what I'm saying? And I think it is very key. In my facility that I work with, we have daily, and this is several locations, we have daily walk-in clinics for emergency care only. We have doctors that are staffed every single day. And let's say they can't afford to have a doctor there. She is absolutely right. They need to have nurse practitioners there. You need to have trained staff and up-to-date equipment. Have to have up-to-date equipment, because as time changes, these machines changes, technology changes, and we have to keep up with that pace. And we have to give our nurses regular training. They should be getting yearly training to keep up with the updates that is going on. And it's ridiculous that this is where we are. In this day and age, people dying from asthma shouldn't be a thing. People dying from diabetes shouldn't be a thing. Cancer treatment, one of the biggest things. When I was growing up, I didn't think cancer was really that prevalent in those days. People ate right. They had, you could get nutritionists to go up to these locations so that you educate, especially the older ones, because they're set in their ways. You need to educate them that, all right, all that provision you was eating back then, you cannot do it as you get older. You have to change your diet. You have to eat better. You can't increase your sugar when your metabolism has changed. So you need nutritionists to be there. You need nurse
health education, health promotion.
Little educations coming. We have community centers. Let's use the community centers and have someone give out educational, diaspora for health. Let's teach them about diabetes. And let me tell you something. There are several things. One thing that I learned from, working where I'm at, there is several conditions among us, especially as Caribbean people, that we suffer with and don't necessarily know we're suffering with, right? I came into a huge group of people that got diagnosed with rheumatoid arthritis, with lupus, with sarcoidosis, something that even in America is not even highly studied. We need to train people to study these things.
Yes,
if this is what our people are suffering from, we need to make sure we have a specialist that specializes in diabetes. We need to make that, which is an endocrinologist. We need to make sure we have somebody who, suffers from rheumatoid arthritis, which is a rheumatologist, who actually also helps with patients who have lupus, who have
autoimmune diseases.
And all those autoimmune diseases like asthma, they can also help up with that. You need lung specialists. We need
specialists.
We need
a whole lot. We need specialists.
We need a lot. And coming from, where my husband, he's an engineer. There's people within us that has these traits and talents. Have them make these machines. Let them come up with if they're engineers, because
innovations,
young boys to go and study engineering, and I know a lot of them from Tobago. You send them out to go study, they come back with a degree and they can't use it. Put them to use their education and let them build these machines. They can do it. The Chinese, the Americans,
Africans doing it.
Everybody's doing
but we have brain drain in Trinidad and Tobago. Look how many of us as professionals are out here and want to go home, and we can't go home, or we won't go home because we don't have nothing to go to help us to utilize our knowledge, skills, and abilities.
Hey.
Exactly. Yes.
But I think this is where we want a conversation with the people who are in charge, if that's what we have to do. Do we need a conference? What do we need? So that we can address some of these things that we're talking about. Because as much as Avia said, Luana said, Stephanie and everybody saying, This is what we want to do. We now have to sit down on the table and have a discussion in a big forum. We need to do that because, you know, we are talking about it and people can hear it.
But they have a lot of professionals that already home with nothing to do, with no opportunity either. So ladies and gentlemen, I think we are at an hour and 43 minutes here, and we're going to take closing statements now from Luan. We're going to get closing statements here from Joan, and then I will have my 2 cents along with Stephanie.
Well, you know, as you know, the panel has said, you know, time and time again, we're sitting here and we're talking and we're reaching people across the diaspora. And I feel that, you know, it's time for us to make a move. You know, it's make or break time. And I think, you know, I've been there, I've done it, and I've experienced the struggles, and the struggles are real. And the struggles, people feel threatened by, you know, people seem to think, you know, you come from abroad, you are more educated. We're certainly not. I wouldn't say that we are. We are autonomous, we challenge, and I think, you know, people in Tobago particularly, we need to start challenging the healthcare system. We need to start challenging the care that we receive. And I think if we stand up and we stand as one, as they said, united we stand, with divided we fall. And if we start fighting, I think, you know, we will make some breakthrough.
Amen.
Amen. So right now we have to send our message to the politicians and to the powers that be. Joan, your closing statements. I wish that I wish we had I wish we can get to go on more, but this is the time, and this is Sunday. And
yes. Well, I'm appealing to the Ministry of Health or health person in Tobago. I think she's from the countryside. We are willing to return back as the older and experienced nurses. We are not challenging them. We just want to teach. We want to help. We're not criticizing. Because there are people who went home and they are feeling as though we are trying to tell them what to do, but we're just trying to educate the community, the public, especially of Tobago, because there's a health disparity there, and we want to fix. We want to help. So I'm already giving back, and I would like to continue. And with our panel here, we like to form an organization where we go down and, you know, whenever we go down on vacation time, to have meetings and give back. Just teach what we learn up here. We are not challenging anybody. And as I have had, and the part I have to come back to this topic, I have had several male on the island complain about the young women, how they are so backward where sex is concerned, because we are older, our panel here, we are older, an older group, and the things that we discuss, the people downstairs, they said, oh, we talk about that. There's no time for that. And, you know, this is nonsense. You know, meet your partner halfway.
Yes.
Work with what you got. If you're with this person, if you're with this person from you, so you're just not like that all the time. Just remember the good old days and work with what you got. Don't criticize the man. That's my story.
Thank you, Joan. Thank you, Joan. Thank you so much. Yeah. Here we have Mary Dates. You can give us Mary Dates. Mitchell, let me bring your Mitchell in. You with this man for all your life. So let me say hello to your husband, hello to your lifestyle, hello to your loving, and hello to your children. You have a twin in between, and you have another child, yeah?
Yeah.
Give us your closing statement. God bless you guys. God bless your family.
Right. The healthcare system in Tobago is broken. It is very broken, and it needs to be totally uprooted and restructured in order to give best care to the people of Tobago. We need best care. We don't want mediocre care in Tobago. We want people to be treated. People must challenge. People, when they ask questions, must get answered. They must not be shouted and batted down when they want to know more about their health. Tobago people also need to be more proactive about their own health. They need to. Everybody has internet and mobile phones. They can Google, and they can Google a lot of things. They can also Google about their health and know what to go and ask the doctors when they go into a consultation. And doctors must give people the opportunity to ask questions and to give back answers. I would love to go home. I would love to go home and run a diabetic clinic from Compoint to Charlottesville.
Yes.
I can do it. I have the knowledge, I have the skill, I have the ability. It is sad that my mother-in-law used to have to leave Delaford to go to Scarborough to be seen in a diabetic clinic. An 80-year-old woman told to starve, she cannot have nothing to eat or drink, and she is on insulin, which was a total no-no.
Dangerous.
That is the sort of treatment people were getting. I want to go. I want to go home. I want to go and work. I want to go and give back to my people, especially where diabetes is concerned, because it is, the morbidity is very high, the mortality is very high. People are losing their vision and their limbs, which is not necessary. And I would love to go back and work, but the system needs to be restructured first.
Hey, look at this. Look at big thing here this evening. Well, Stephanie, you give us your closing statements now, because my Mary Dates just send the nail right in with her hammer. Yes. Thank you,
my
Mary
area
Dates.
of specialty is public health and health promotion, health education. I would like to add what Mary says. A lot of men are suffering because of hypertension and diabetes, and they have become impotent. And they have decided to deal with it by drinking all kinds of stuff, when it could be addressed by managing the diabetes, hypertension properly. So my objective I would like to see is to raise the levels of health promotion, health education, reduce the set of domestic violence, because when they can't perform, they beat the women up, and just reduce that whole level of violence in the home.
Isn't it a double whammy blow that a man can't even perform good, but he beating you on the other hand, and he going out with another woman too,
to try to boost his ego.
So family that is the worst pain to feel. He can't satisfy you. He's cheating on you with somebody else who must be just doing either something else he like or nothing at all, but just getting the money. And when you talk, he beat you. So, ladies and gentlemen, we have another show coming up with these same ladies. Some of them, I might split them up, because the bigger the panel, the longer we will have to stay with the timing. Because you guys have so much to offer. You guys have so much answers to give. I saw Avi hand was up while you were speaking. Stephanie, Avi, you have anything else to interject?
I just want to make one statement. And, when it comes to people feel like we're coming back to take something from, it's not about taking anything from. I want to make this absolutely clear. We don't want to come back and take anything from anyone. It's more so a given, because you have to remember, we have families and friends and neighbors and auntie and uncle and nenen in these villages. And it's because we care about the lifestyle and the health care that they receive. We only want to see them live to fruitious lives. And that's it.
Amen.
I don't care if I have to do it freely, because it's personal for me. It's not about the money. It's not about taking your fame and fortune. It's about a personal reason. We want to see our villagers living healthy and living right. That's it. Nothing else.
Nothing else. Nothing is free, because there is no salary. There is no salary that Trinidad and Tobago will offer you that you gonna rush for and leave what you're getting here in America. They can't pay you.
Never.
Trinidad and Tobago can't pay us for coming back.
Can I say
all the corrupt politicians, they steal out all the money. But they will accept us to come home to work for free. I ain't using no free word with them. Because when we come back home, we will want a place to live. We will want to get tax-free vehicles also. We will, yes, it ain't free. The Caribbean need the nurses and doctors from abroad. So we're going to stop saying the word free. We coming home to give back. Just coming alone. That's disrupting our lives here in America to come back there. We don't have husband there. We ain't have children there. We here. So we coming home and you guys should accept us. You accept the Minister of Finance or somebody in finance who was in Ghana. You're bringing back home to run banks because he's your friend. Or your daughter's going away and study. Most of them must even buy their thesis and buy their crap. They reach back home, or you're giving them job. Or you're making sure they go in. And the people that out here that could save lives, you guys thinking it hard to open up the doors of mercy and to bring them in. Bring somebody in. I ain't saying that our nurses home and well trained, but we need more trained nurses in different specified, in different
but nurses
specific
home need
fields.
to be more autonomous. They need to be more autonomous. Nurses home has to stop being doctors' handmaidens. Stop being doctors' handmaidens. When you go to the hospital with an asthma attack, if a doctor don't say put on a nebulizer on the patient, you cannot put on a nebulizer. And the patient is there struggling to breathe. That's craziness. Nurses are autonomous practitioners. And that is what we need to stand our ground and empower our nurses at home so they can become autonomous practitioners. And that's what we want to come home and do. Help you all to be autonomous. Help you all to stand up for yourselves. And let the doctors know that you have authority as well. You have a body that you have to answer to. Call your nursing council.
And Mary, PIN number.
Mary, let us be specific here. It's not all nurses can give a nebulizer stuff. We're talking about NPs. Open the doors for trained NPs. Train some of your nurses now to be nurse practitioners. A nurse practitioner is some steps below a doctor. So if a doctor not there in the emergency room and you're sent to call him and a nurse practitioner is there, she will prepare that patient in a way.
Mama Coco, I am a nurse practitioner. I go out and I work. I work in GP surgery. Many times my GPs come and ask me for a second opinion.
I know, we know all this, but we say,
so that is why
don't have them
we need to have them.
Yes, we need to train them.
They are there. There are people there, but they cannot work as nurse practitioners. One of my best friends is in Tobago now. She is a qualified nurse practitioner. She cannot work there.
She's who you talking about that could do this.
Yes, and
listen to me. In America, we're going to close here now because we're not going to go to past the 2 hours. In America, the minute they admit you, you go to the emergency care and they admit you. They open up veins. They start to give you, they open up veins and get veins ready in case when the doctor get to you, you have to be placed
on. When you get triage, you're just licking everything one time.
They fix you one time. In Tobago, they don't even have triage working good there in Tobago.
They don't triage people.
So, ladies and gentlemen, this was an awesome
please,
show.
The triage there, please.
The triage you, dead people.
Stop it.
Trinidad and Tobago government doesn't recognize NPs. Ladies, one last question from me, and we're going to end. That I want to thank all my guests. Do you think, because of what we spoke of earlier, the sex and stuff like that, should people be recommended to see therapists? A therapist should come into many abuse relationship. Mm-hmm. Do you guys believe in therapy?
Of course. Yes. Most definitely.
We strongly agree. I agree.
Well, that was our closing question, and I'm glad that we are in agreement, and we are going to have our next discussion There two selected. I don't know if anyone else would be there. Is to speak of impotence. We are going to speak of colonoscopy, especially in men. We're going to speak of what these men they suffer from again.
Prostate.
Prostate.
Yes. Colonoscopy. There's no screening currently.
We're in Tobago.
Yeah, for colonoscopy.
So our
most patients
next show,
present when they're symptomatic.
You see what I mean? And our next show, next time, which is next week, I believe, you ladies will get it. And if any one of you who will not receive an invitation, but you are on this panel, that you are able to speak on that, please let me know. The show is already booked for, I think it's the 8th of November. So good evening to everyone. I know every one of you can speak on something or about someone that you know. Many of us, our parents have suffered from it that we used to call stoppage of water. Stoppage of water is not a medical term. We are going to go into the right term. You know, prostate cancer. Yes, prostate, yes. We are going to go into that because a lot of young men, and we want to tell a lot of men in Tobago, but there is a stigma that young men can't be suffering from that. Is that for real, or is that just a steal?
That's just a fallacy.
A lot of men have
That's a myth.
So I love you guys. You guys can stay. You guys can stay after the show where you sit, so we can have a little discussion after this show. And to all my guests and to all the guests there, let me let you know that you guys are well appreciated and the audience love you. We're sorry that we can't read more of their statements and their